Hello, 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 everybody. I'm so happy we are here together. I'm Dr. Samm Price. I'm a licensed naturopathic physician. I'm an expert in natural medicine. Through my books, my #1 best-selling books, my concierge medical practice, and my live event, Vital, The Experience. It's an international 2-day wellness retreat, which is happening in Playa del Carmen in 2020. Ask me about that later. But today we're here to talk about flu and cold season. It's here. So it usually starts around August and lasts sometimes all the way through March. So what I want to talk about is some basic tips, naturopathic tips that we can do to prevent and beat the whole season, okay? So #1, let's talk about what is the flu. It's actually a virus. So viruses there's many different ones. So there's influenza A, influenza B. What they do is they actually break off and make other little subsets of this virus. And they're spread by human contact. So you can get it through your skin, your mouth, your nasal mucosa, and we have to be very diligent about not spreading it. So that's what I want to talk about, spreading it and preventing it and treating it, okay? So type in the chat for me if you're here. Let me know that you're here. One is I want to talk about how it spreads and what it causes. So once the virus gets into different respiratory tracts, then it can actually replicate. Once it replicates, then it can affect other healthy cells in our body. And when it does that, we call that a viral infection. So once we've got the infection, then it can cause different symptoms. For example, if it spreads to your throat area, it can cause a sore throat, right? If it spreads to the blood, it can cause muscle aches and cramps and pain and things like that. If it spreads to your GI system or your stomach, it can cause nausea and vomiting. And the lower intestinal tract area, if it spreads there, it can cause diarrhea. So everybody's like, well, how can a virus affect the whole thing? Well, it just depends upon the different cells that it's affecting. So this is how it spreads, how it affects us in different ways. So you know that if you're having diarrhea from a viral infection, then it's all the way in your lower intestinal tract. Does that make sense? I hope so. All right, so let's talk about how it gets spread. So coughing and sneezing, you know how people don't cover their mouth and stuff like that? That's how it spreads. So they teach little kids in school now to cough in your elbow crack or to sneeze in your elbow crack, because if you cough and sneeze in your hands and then you don't wash your hands, then you're touching different things and everything gets spread. Very seldom, if you cough and sneeze in your elbow crack, will you actually touch that area, okay? If you're one of those people who cough and sneeze in their hands, please stop doing that. Please do it like this. If you still do it, make sure you're washing your hands immediately after so that you're not touching areas that can possibly infect other people. So that's coughing and sneezing into the air. So even if you do it this way, some of those particles are going to get into the air. And so this is how some people just get infected, because they're in the vicinity, right? The second way is that you can kiss or drink after someone. So my husband and I are very diligent when one of us is sick. Okay, baby, I love you too. On the top of the head or somewhere else. We do not kiss on the mouth, and we're very diligent about not kissing or drinking after each other. And that's why a lot of times in school they're like, do not drink after anybody. So make sure that you're washing those dishes really well if somebody in your house is sick. No kissing at all if you are sick, because it can spread the flu and the cold, okay? They can be left on cups. They can be left on doorknobs, telephones, eating utensils. So you have to be very diligent about being clean when you have the flu or virus, or if somebody you know and you're around them constantly has the flu and virus and you're trying to prevent it. Make sure that you're washing the dishes really well. Make sure that you're not quarantining them, but basically they kind of need to be off on their own, okay, until they get over it. I want to talk about the difference between the flu is a virus. It is not a bacteria. They are two different things. An antibacterial agent is not going to help if you have a cold or flu. that is a virus. So please don't come ask your doctor for an antibiotic. It's not going to work, okay? Let's see. Does everybody who, so these are questions, does everyone exposed to a viral particle develop symptoms of the flu? No. This is a great question. So if you have a robust immune system and you're doing all of these things that I'm about to tell you about, you can beat the flu and the cold. You'll never even know that you have it. We're exposed to viral particles all the time, and our body internally is working overtime to prevent us from getting sick. So one of the things that it does, there's a couple of different things that happen in our system that you don't see. One is it will mount a fever. So this is kind of controversial. Everybody wants to pop a pill and reduce the fever. Oh my God, somebody has a fever. Fevers are good, okay? If you're sick and you don't get a fever, that's when you should be concerned. Our body's natural response to a virus is to mount a fever. A fever up to 101, 102 is fine, okay? I know that people are concerned about febrile seizures, so these are seizures in kids. There's no real evidence that says that there's long-term damage from a febrile seizure. Now, if you're at 102.5 or so like that, yeah, call your doctor, okay? But a fever is a natural response of our body. What it's doing is it's saying, alert, alert. It's like an alarm system. It's heating up our internal body to help to actually burn off the viral particles. Does that make sense? I hope so. All right, the other thing that it does is there's something called the innate immune system, the adaptive immune system, and the cell-mediated immune system. Big fancy terms, and it's very complicated, but basically what it does is each time we get sick, our body says, it throws up a red flag. It says something's not right, something's going on. Call in the defense mechanisms, interferon, natural killer cells, all of these things that we automatically have within our immune system. We even have a system that helps to recognize, oh, I fought that before. Here's what we need to do, and it calls in the cavalry. So our immune system is very unique. God created it that way, and we should be able to fight it ourselves. However, to a point where it is, it's penetrated all of our immune defense systems, we have to boost the immune system with nutrients, rest, water, those type of things. So let me talk about what we can do to actually boost the immune system. So let me see if there were some more questions that I was supposed to be answering. Two things. One, to help beat and prevent the flu system, we have to actually keep our immune system in check. That means to make sure that we're constantly nourishing the immune system. And then there's some things that we absolutely need to do if we think that we've come down with the flu or the cold. So let's talk about some things that you can do. So like I talked about, coughing and sneezing into your elbow crack, that's one that you can do. But the particles are still going to fly, right? So the other thing that you can do is wash your hands, okay, with soap and water, all right? The antibacterial, what are those things called? Pumps, that's antibacterial. That's not going to do it. It's actually got some things in there that are hormone disruptors, and we can talk about that on a different segment. But I want you to wash your hands with soap and water. The way that they teach the kids to do washing your hands is you can sing the ABCDEFG song, or you can sing Happy Birthday. That's how long you need to be washing your hands. Make sure you're getting the tips of your fingers. If you want to, you can get underneath your nails, but you need to wash your hands very, very well, okay? If you're in the healthcare industry, gosh, please wash your hands after you see every single patient, okay? To make sure that you are protecting yourself from the cold and flu, all right? Limit your exposure. So this means if you need to wear a mask, if other people in your cubicle or your office space are sick and whatnot, you can wear a mask to prevent yourself from coming down with the cold or flu. If they're sneezing, even in there, remember I told you air particles, right? So you can wear a mask to help prevent it. You can stay away from high crowded areas to reduce your risk of getting the cold and flu. Okay, this is hibernation season. I'm not saying that you don't get to go out and stuff like that, but just boost your immune system before you go out into a crowded area. Okay, and make sure you're washing your hands. You can maintain a strong immune system. One is what you're eating, okay? So you have to eat a whole foods diet. I talk about sleep all the time. Sleep is a great way to boost your immune system. So like I said, it's hibernation season. Hydration, I talk about this a lot too, so go watch some other videos on that, but basically it's not just water. You need to have electrolytes in that water to make sure that you're staying hydrated to keep your immune system up. Super big one that I talk about all the time when we talk about cold and flu is your sugar intake. This is the time to decrease your sugar intake, you guys. Sugar depletes your immune system, and the immune system is our first defense. You don't even know it, but your immune system is working right now. But if you're constantly having sugar in your diet, cakes, putting sugar in your coffee and your tea and all of that kind of stuff, you're depleting your defenses to possibly help you from not getting the cold and flu, if that makes sense. I'll probably talk about this in October, but for my child who's 6, when we go trick-or-treating, he gives all of his candy to what we call the switch witch, and he gets a toy instead so that he's not constantly having all of that sugar in that time period. If you notice, most kids get really, really sick right after Halloween. So like that first part of November all the way through Thanksgiving, because they're high on their candy from Halloween, and it's already a time when we've got cold and flu particles in the air and stuff like that, so they're depleting their immune system. So please decrease your sugar intake for the next like 5 or 6 months. And eating warm foods. So warm foods, as our months become a little bit cooler, like we're gonna have 79 today, but as the months become cooler, you wanna eat warming foods. So not like salads and not like, potato salad or that kind of stuff. You want soups and stews and things like that, so that the body can adjust to the cooler weather. I have 8 pages that I'm talking about today, so I'm trying to get through it. All right, so let's talk about the basics. The basics of things that you can take. So we can take a multivitamin. I'm happy to recommend one for you. You can take a probiotic. This is gonna help with the gut immune function. So your immune system is also located in your gut. So probiotic is very, very important so that we make sure that we maintain the proper intestinal flora balance. Essential fatty acids are EFAs, are fish oils. Fish oils help to coat the membranes. They help with your inflammation from the neck up and also from the neck down. So I like that. They help with proper cell membrane fluid, which is going to help to capture the little particles, the viral particles. Vitamin C, vitamin A, and vitamin D, all antioxidants that I like. Vitamin D I usually tend to boost in this season anyway because we have seasonal affective disorder. And I talked about that I think a couple of weeks ago. Zinc, you should have vitamin C and zinc in your house. You should also have elderberry in your house during this cold and flu season, especially if you have children, guys. So zinc, I like the chewable ones. You can buy the capsules as well. They work just as well. A mushroom blend. Mushrooms are great for your immune system. And then there's something, I like a homeopathic flu tincture. So basically, what I do instead of the flu vaccine is we have a homeopathic that we do. So you can buy something called influenza. It's usually at Whole Foods, but the one that I give my patients has a 65-year history. It's called Camp's Formula. And she basically takes the formula from the elders that has a 65-year history. Well, it's probably more than 65 years now because I've been saying that for a while. So she takes that formula and then she takes the strand that they think is going to be this year's strand, and then they takes a France strand as well and mixes it so that you're really well protected. So like you guys know, I think it was last year or the year before, the flu vaccine that they gave strand right. So it's very hard, and the flu, it can be any kind of strand, so it's like a guessing game. So I like this one because it has many different strands in it, and it is well covered, and it's a broad spectrum. So let's talk about some herbs that we can do. So we can do ginger root. That's great for nausea. So remember I told you that if it gets into the stomach area, you've got nausea and vomiting. So chamomile. So I really like, you know how I have in the nap system, I have where you should do a bedtime routine. So this is the time of year where I would say do a cup of chamomile tea at night as part of your bedtime routine because it helps to relax the body, but it also supports your immune system. Astragalus, elderberry, like I talked about, Avena sativa, which helps antispasmodic, so that would be the cramps in the stomach area. Ashwagandha, echinacea. Many of my patients know about this because we talk about it. Echinacea is great. However, you can develop not a sensitivity to it, but a resistance to it. So you can't take that consecutively. You have to take a break on echinacea, and I think most people don't understand that. So I would like take that for 3-4 weeks and then take a break, and then you can go back to echinacea. I talked about Camp's formula and influenza. There are some homeopathics to treat it, but I think that you should be under the care of a naturopathic physician in order to actually do the homeopathics. But I will give them to you at the end of this broadcast. Other supplements, so I talked about the vitamin C, I talked about the mushrooms. Elderberry is fantastic, even kids. My kid is 6 and he loves elderberry syrup. Astragalus, okay. I have a super duper secret flu, what do you call that, treatment that I like that I'm going to tell you about at the end of the broadcast. Foods, so soups, like I talked about. I love to keep chicken soup, homemade chicken soup on hand. I'll make a big pot, and I'll let it cool down, and then I'll freeze some of it in individual bags because invariably, sometimes it is Deuce who gets sick, or Sean who gets sick, or me who gets sick, but maybe not all of us. So you don't want to do the whole pot. You know, you freeze the whole pot and then bring it out and unthaw it. So I've kind of individually freeze them so that I can just take out a little bit for that person. It's so important to put the right ingredients in there. So bone broth is absolutely fantastic for your immune system, but what else I like in there is mushrooms. Remember I talked about mushrooms are great for enhancing your immune system. I put carrots in there for your beta carotene or vitamin A. What else? I put onions in there for quercetin, garlic for the allicin benefit, antiviral, antibacterial, antifungal. So it's the things that you're putting in the soup that have intention to actually heal what's going on. And it's the broth. It's actually getting the nutrients into the broth or the water. That's the most important part. Ginger ale. Ginger ale is great for nausea, vomiting, any kind of, if the virus has gone down to the stomach, it's fantastic. But what I'm talking about in ginger ale is sparkling or mineral water where you crush up some fresh ginger and you drink it at room temperature. You can't drink it over ice. Mineral water at room temperature, sparkling water at room temperature helps as well as the fizzies that do it. Crackers, like saltine crackers will work, or white or brown rice help as well. And then there's a naturopathic formula called an oxymel that I use all the time at the very beginning. If I think somebody has the flu, we're automatically going to make an oxymel, and I'll tell you about that at the end of the broadcast as well. There's an immune soup, which I have a recipe for as well. Like I told you, I have 8 pages to go through for you guys. A couple other things. So skin brushing. If you can buy an organic loofah brush, most of the Whole Foods stores have that, or your Trader Joe's. You're going to brush up towards your heart, and this helps to stimulate the lymphatic system, which is going to help you detox, which helps to improve your immune system. So we want to do that every single day. Before you bathe. So Epsom salt baths are great for relaxing. You can add different minerals in there. Always, I suggest you stand up and then shower in cool water. Helps to increase your energy and stimulate your immune system. And then the fever, I told you about the fever. So one of the things that I haven't talked about before, which I thought that I would mention this time, is something called convalescing. And I think that this has been lost in our society. So what happens is we take a pill and then all of a sudden the fever goes away, or the chills go away, or aches and pains go away, and then we're back at work. or we're back doing school, or we're back doing whatever it is that we do. There is something to be said about convalescing. Convalescing is actually, once you're better, giving your body 3 to 5 days of rest to catch up. I hope that makes sense. So it's really important. So just like when the doctor gives you an antibiotic, right? They want you to take another couple of doses even after you feel better. The rest, relaxation of a couple of days after you're feeling better is so important, you guys. So I'm hoping that you guys will agree to at least 2 days of convalescing. Are there any questions? Feel free to ask me any questions even after the broadcast, and I will make sure that I answer the questions for you guys. But what I have for you guys today is, if you go on my website, I actually put all 8 pages that I talked about, including the recipes, on my website. So there's a pop-up up there. You guys can sign in and you can get the 8-page report on the basic immune function prevention and treatment guide by me. If there are no questions, I am Dr. Samm Price. I'm a licensed naturopathic physician. I'm an expert in natural medicine. They're my #1 best-selling books, my concierge medical practice, my live event, Vital, the Experience, which is a 2-day wellness retreat just for you. I help you bridge conventional and alternative medicine to transform your illness into wellness. So go to my website, www.drsammnd, that's drsammnd.com, and you can get the 8-page report about the basic immune support and prevention and treatment of cold and flu right now. Have a great day. Talk to you later. Bye.